Welcome back to the Operation Freedom YouTube channel. What we do here is shine the light of truth on the deep state. They hate that. We do it figuratively with our presentations. We do it literally with our sponsor's product, PatriotLegacy.com. PatriotLegacy.com, featured product of theirs, the Patriot Beacon. 6 overall lighting functions. In addition, solar powered, don't need batteries. You can charge your other devices like your phone from it. In addition, you got a compass, you got a window breaking hammer, and you got a seatbelt cutter. Plus, if those deep state dweebs get just a little bit too close to you, blast them with this. They're gone. Go to patrioticlegacy.com, patrioticlegacy.com. Get yourself, your kids, your grandkids, your car. Can carry it with you anytime. patrioticlegacy.com, the Patriot Beacon. Let's also talk about more political cover. I want to give you a history lesson that you're not going to get from the bought-off lamestream fake media. I want to take you back to 2009, Barack Obama, president. This from Red State, Elizabeth Vaughn. In April 2009, swine flu, H1N1, became a pandemic. April 2009. 6 months later, October 2009, after 1,000 deaths, Obama finally declared it a public health emergency. So when these people, and I'm sorry to insult people, in the press say to President Trump, have you contacted Barack Obama or George Bush about what you should do? Okay, Obama, the guy who sat on a pandemic for 6 months, and 12,500 people ended up dying in this country, and 61 million ended up getting infected because he was too busy in 2009 trying to jam Obamacare down everybody's throat. President Trump is supposed to call him? Or George Bush, who did such a phenomenal job handling Katrina? That deep state player? I give President Trump a lot of credit. He looked at him and goes, why would I call them? Look what they did. And the press jumped all over. Whoa, I see being so critical of former presidents. How about with Obama, and that's just the tip of the iceberg with Obama, 12,500 dead before he acted upon it, before it was all said and done. It's from Red State. In April 2009, swine flu was first detected in the United States. April 2009. According to the CDC, this virus was a unique combination of influenza virus genes never previously identified in either animals or people. Sound familiar? Yeah. It began to spread immediately, and President Obama addressed Americans briefly. How many press conferences of over an hour has President Trump had with the experts around him also speaking? He did this. He addressed Americans briefly for 1 minute and 27 seconds. That was it. At the end of April, he said that U.S. health officials were monitoring the situation. Oh, good. By October 2009, Dr. Thomas Frieden, director of the CDC, told CNN, quote, millions of people in the United States have been infected. At least 20,000 have been hospitalized. And more than 1,000, I believe 100 of which were children, have died, end quote. President Obama finally declared swine flu, H1N1, a public health emergency on October 24th, 2009, 6 months from when it first hit our shores. He issued a statement which read, quote, the 2009 swine flu pandemic, H1N1 pandemic, continues to evolve. The rates of illness continue to rise rapidly within many communities across the nation, and the potential exists for the pandemic to overburden healthcare resources in some localities. Thus, in recognition of the continued progression of the pandemic and in further preparation as a nation, we are taking additional steps to facilitate our response. On November 12, 2009, about 2 weeks later, the CDC reported an estimated 22 million Americans had been infected with H1N1 and 4,000 Americans had died. Fast forward to 2020. China first reported the coronavirus to the World Health Organization on December 31st, 2019. According to the American Journal of Clinical Pathology, on December 30th, 2019, scientists in China reported, quote, a cluster of patients with pneumonia of unknown etiology was observed in Wuhan, China, and reported to the World Health Organization, December 30th, 2019. A week later, January 7th, 2020, a new coronavirus was isolated from these patients, end quote. The first case of coronavirus in the United States was January 21st, 2020. On January 31st, 10 days later, 2020, President Trump, not 6 months, 10 days, President Trump declared a public health emergency. 1 person had died. USA Today reported that, quote, quarantines of Americans who have recently been to certain parts of China had been set up. The first quarantine order issued by the federal government in over 50 years, end quote. And what was Joe Biden's response? Donald Trump is a xenophobe. He's a racist. Thanks, Joe. Wrong again. The Washington Post. This is an overreaction. Wrong again. The head of the World Health Organization. By limiting people from China coming into the United States, this will make the virus worse. What? Well, what do you expect? What's the World Health Organization associated with, right? United Nations. Welcome to the deep state. Welcome to the globalist empire. There's a piece of history you're not going to get. Let me give you another piece of history. And I went through this with our subscribers several weeks ago. Well, let's try it. Let's roll it out. I have seen umpteen people saying this is like the Spanish flu of 1917 and 1918. There are millions going to die. Many hundreds of thousands in the United States. All right. History. Spanish flu, 1918. True. Deadliest pandemic in the 20th century. The H1N1 influenza virus were genes of avian, bird origin. 500 million people in 1917 and 1918 worldwide became infected, 1/3 of the population. Did 1/3 of the population die? No, but a big chunk did. 50 million reportedly died worldwide. 50 million. In the United States, 675,000 individuals died in the United States. Now, do you believe that our society of 2020 has had any improvements across the board since 1918? Call me an optimist, but I believe we have. Like what, Dave? Well, let me tell you. In 1918, there was World War I. It was ongoing. There were movements of troops in very large numbers, who were in very close contact. And what do we know about social distancing? It does help. Well, there was no social distancing, to say the least. There were limited health services available. World War I was ongoing. 30% of all healthcare providers were funneled into the military, leaving the population with very few healthcare providers. There was very little healthcare providers could actually do at the time, though. Living spaces were overcrowded, not just in the military, but throughout the United States. The medical technology was essentially non-existent. There was no testing available. The docs didn't even know about the existence of viruses at that point. There were no antibiotics. One of the reasons people died from that influenza virus is that after they got the virus, they got secondarily infected. They had a second infection on top of it with a bacteria, which could be treated with antibiotics. But not back then. There were no antibiotics. Today, we have antibiotics. Just look at one of the proposals for coronavirus that's been President Trump has spoken about. That there's a controlled, not anecdotal, controlled study out of Marseille, France, from an excellent researcher that looked at hydroxychloroquine with Zithromax, an antibiotic, but the Z-Pack you hear about. And the results in that small population study, but still very significant and very positive, which is why we're starting to see that medication regimen used around our country. Was chloroquine available then? No. I think chloroquine didn't hit the scenes until about in the 1940s. Was a Z-Pack available then? No. There were no antibiotics available then. Intensive care, ICUs, ventilators were non-existent. There was no coordinated planning. And there was poor hygiene. So when folks tell you that this is going to be the Spanish flu of 1918 all over again, well, there was an organism at the cause of that. And there's an organism at the cause of this. But if you think we're the same place we were 102 years ago, not buying that plate of panic and misinformation you're handing me. You hear about this push for vaccinations. I've discussed this on my platform on Operation Freedom, the radio show with Dr. Shiv Chopra. He since has passed away. But we've discussed this at length on my platform. And that's a discussion for another day. But I want to give you a history lesson because we don't want to repeat mistakes of the past. And I take you back to 1976 when Gerald Ford was president. This from the Smithsonian Magazine. Kat Eschner. The long shadow of 1976 swine flu vaccine fiasco. This is what we need to avoid. Which is why I believe President Trump the other day spoke at his press conferences. We have to, if this is going to be done, a vaccine, well, we have to make sure it's safe and effective. And people said, oh, that's terrible. They brought that up. No, it's not. No, it's not. Because to go after him on that statement means you are ignorant of history. In the spring of 1976, it looked like that year's flu was the real thing. Sound familiar? Spoiler alert, it wasn't. And the rushed response led to a medical debacle that still hasn't gone away. Quote, some of the American public's hesitance to embrace vaccines, the flu vaccine in particular, can be attributed to the long-lasting effects of a failed 1976 campaign to mass vaccinate the public against a strain of the swine flu virus, end quote, writes Rebecca Creston for Discover. Quote, this government-led campaign was widely viewed as a debacle and put an irreparable dent in future public health initiatives, as well as negatively influencing the public's perception of both the flu and the flu shot in this country, end quote. This is a story about the one time over 40 years ago when poor decision-making on the part of the government led to the unnecessary vaccination of about 45 million citizens, some of whom developed severe complications. On February 4th, 1976, a young soldier named David Lewis died in a new form of flu. In the middle of the month, F. David Matthews, the U.S. Secretary of Health, Education, and Welfare, announced that an epidemic of the flu that killed Private Lewis was due in the fall. Quote, the indication is that we will see a return of the 1918 Spanish flu. Whenever you hear somebody say that, look out. You know who they're working for. That this is the most virulent form of flu, end quote, he said. He went on, the 1918 outbreak of the Spanish flu killed 500,000 Americans. Well, that's true, but come on now, buddy. Times have changed. And the upcoming apocalypse was expected to kill 1 million. To avoid an epidemic, the CDC believed at least 80% of the United States population would need to be vaccinated. When they asked Congress for the money to do it, politicians jumped on the potential good press of saving their constituents from what they call the plague. Sound familiar? The U.S. government was unstoppable. They had promised a vaccine, so there needed to be a vaccine. This all happened in the spring with emergency legislation for the, quote, National Swine Flu Immunization Program, end quote, being signed into effect in mid-April 1976. By the time immunizations began on October 1st, 1976, though the proposed epidemic had failed to emerge. Quote, with President Ford's re-election campaign looming on the horizon, the campaign increasingly appeared politically motivated, end quote. This is Creston writing. Quote, epidemiology takes time. Politics is often about looking like you're doing something, and logistics between branches of government are extremely complicated. These factors all contributed to the pandemic that never was. The real victims of this pandemic were likely the 450-odd Americans who came down with a condition because of the vaccine called Guillain-Barré syndrome, a rare neurological disorder. Some people believe it was much higher than that, by the way, after getting the 1976 flu shot. On its website, the CDC notes that people who got the vaccination did have an increased risk of approximately an increased risk. Guillain-Barré syndrome. It's a condition when the immune system reacts in a patient, and that immune system attacks the peripheral nervous systems of a patient, and it can lead to paralysis. And it was found that this vaccine in these 450-odd numbered people caused that reaction to happen, and there were many people believe that that figure is an underestimate. For anything, whether it's a drug, whether it's a vaccine, whatever it might be, we have to make sure that it's safe and it's efficacious. We have been exposed. I don't know if you've watched these Andrew Cuomo. One of these days, I'm expecting him to just walk out with a sweater on because, he's like Mr. Rogers. He's actually become kind of like this, trying to act like this father figure. I think somebody's going to try to run for president. And he does these PowerPoint presentations that are very slick about how he cares, giving us advice about society and humanity and the latest on the virus. And then, of course, he was screaming that he didn't have enough ventilators and the federal government wasn't helping getting them and the like. And, the citizens in his state are dying, which they are. But here's a part of history he's not telling you. So when you see this guy on TV acting like he's Ward Cleaver from Leave It to Beaver, Mr. Dad, you know who he's like? He's a hypocrite. He's a hypocrite. Headline. New York Governor Cuomo rejected buying recommended 16,000 ventilators in 2015 for a potential pandemic. Instead, he established death panels and a lottery instead. What? This is this guy who's acting like he's everybody's dad, and I'm going to go to Central Park and I'm going to talk to people about they have to stand 6 feet apart and they shouldn't be congregating. Let me give you my presentation about humanity and society and helping others. Really, Andrew? Because the history, man, really, really is contradicting what you're talking about and stating that you couldn't get ventilators from the federal government. You want to know who's responsible for not having enough ventilators in the state of New York? Andrew Cuomo needs to look in the mirror. Governor Andrew Cuomo's 2015 decision did not fix a shortfall and buy the recommended 16,000 ventilators to shore up the state's stockpile in case of a pandemic. Cuomo spent more money than the cost of the ventilators, you ready for this? On a solar panel boondoggle, reports former New York Lieutenant Governor Betsy McCaughey. I believe she wrote this in creators.com. McCaughey reports that the Cuomo administration decided instead to establish triage officers to decide in a crisis who would get a ventilator and who would be left to die. Just like a good globalist. I mean, let's face it. This is why I went nuts about Obamacare. About a bunch of bureaucrats. We're going to set up a ration-based approach that was based on a criterion such as age and the like. It's inhumane and it's unethical. Let me go on. It has also been reported a ventilator lottery would be an option in a pandemic crisis in New York because of Cuomo's decision. Now with the coronavirus, the Chinese coronavirus overwhelming New York hospitals, Cuomo is begging for ventilators. Excerpt from McCaughey's article. Quote, after learning that the state stockpile of medical equipment had 16,000 fewer ventilators than New Yorkers would need in a severe pandemic, Governor Andrew Cuomo came to a fork in the road in 2015. He could have chosen to buy more ventilators. Instead, he asked his health commissioner, Howard Zucker, to assemble a task force and draft rules for rationing the ventilators they already had. The task force came up with rules that will be imposed when ventilators run short. Patients assigned a red code will have the highest access, and other patients will be assigned a green, yellow, or blue, the worst, depending on a triage officer's decision. In truth, a death officer. Let's not sugarcoat it. It won't be up to your own doctor. Cuomo could have purchased the additional 16,000 needed ventilators for $36,000 apiece, or a total of $576 million in 2015. $576 million would have done the job in 2015. It's a lot of money, but less than the $750 million he threw away on a boondoggle Buffalo Billion solar panel factory. When it comes to state budget priorities, spending 0.5% of the budget on ventilators appears to be a no-brainer. So far in New York, across New York, there were 7,241 ventilators in acute care settings. Another 1,750 stockpiled for use in an emergency, according to the 2015 state report. Cuomo. Here's what Cuomo's saying. Well, in New York, ventilators right now, well, globally, you can't buy them. This is now, 2020. We're going to have to make them or make something like them. And that's why the federal government is stepping up and ordering the manufacturers to now come together and make this happen. It's going to be imperative. On Friday, March 20th, 2020, Cuomo spoke to reporters via the New York Post. It's ventilators, ventilators, ventilators. That's the greatest need, Cuomo told reporters at the state capitol. We're notifying any health department in the state if you have a ventilator and you're not using it at this time or it's not essential to your use. We want it. We want it. Yet in 2015, he took the money that could have been spent on ventilators for a pandemic, a potential pandemic, and he blew it all on a solar plant that went bust. And he's there every day, acting like he's the big dad, looking out for everybody's welfare. Well, you know the truth. And you know the truth because you know the history. And it's history that the political elite do not want you to know about. Panic is easy. A measured, rational approach is what is difficult. but it is what is needed by all of us to get to the other end of this issue. This is a huge plate of chaos that's been put on our table. I suggest you push the plate of chaos away. Stick with the facts. Stick with the data. Remember history. My mom, the history teacher, drilled in David's head. If you forget history, you're doomed to repeat the past. We're not going to repeat the past when it comes to the Spanish flu. Things have changed. We have had breakthroughs. And I truly believe having a businessman, love him or hate him, having a businessman who's made critical decisions in his life is the key. I'd rather have him at the helm of the ship rather than some career politician who sold 20% of our uranium supply to the Russians, or some guy who took 6 months to make a decision about implementing a national emergency. I thank you for your time. I hope you become a member of our platform. That's what keeps this YouTube channel going. It's what keeps our platform, our radio show going. Without the support of our subscribers, it all goes away. Some people would like that. Hopefully you're not one of them. Extra shows, extra content, extra analysis, all the archives to our shows, all available to our subscribers. I believe the biggest bang for the buck in all the internet. Dump your cable bill. Get rid of it. It's just feeding you plates of chaos every day. At our platform, you get the facts, you get the data, you get the analysis, and you get the history. It's the biggest bang for the buck. Until next time, Dave Janda signing off. Thanks for your time today. Dream big and dare to fail.